Hey everyone, Bypass Blake here. Today's video is going to be all about the duodenal switch surgery. I will explain how it works, how much weight you can expect to lose from it, and what time frame, and also discuss the recovery time from surgery. You don't want to miss this, so stick around. The duodenal switch, also called just the switch, or medically called Biliopancreatic Diversion with Duodenal Switch, or BPD-DS. This surgery doesn't just have a complicated name, it is the most complicated of all the bariatric surgeries. The highest risk of all the surgeries, but it also has the highest reward. The switch is very complicated and is only performed by certain surgeons with expertise to perform it, and it is typically reserved for the severely obese with typically a BMI over 40 or 50, with diabetes and other severe medical issues, and even patients that have failed gastric sleeve or gastric bypass. The best way to explain the surgery is the switch is basically a combination of both the gastric sleeve and the gastric bypass surgeries. Like the sleeve and the bypass is typically performed laparoscopically. It's performed in two steps. First, completing a gastric sleeve by removing 80% of the stomach and making the same banana-shaped pouch as your new stomach. Then, the surgeon divides the small bowel that normally connects to the old stomach, the duodenum, to create the bypass. The food you eat would normally go from the sleeve into the initial part of the small intestine. However, with a switch, it is rerouted or switched to the lower part of the small intestines, bypassing a significant length of the small intestines so it absorbs less calories but also absorbs less vitamins and nutrients. It is important to note that the switch patients have a significant amount of malabsorption and require significantly more vitamins and minerals supplemented than compared to the gastric sleeve or the gastric bypass. Up to 18% of people that have the switch surgery develop some kind of protein or energy malnutrition. Vitamin requirement for switch patients is recommended by the American Society for Metabolic and Bariatric Surgery is as follows. You have to take extra vitamin A, vitamin D, vitamin K, multivitamin with 200% of the daily values, iron supplement, calcium supplements with 3 to 4 doses daily, vitamin B12 supplements with sometimes injections every month, and drink 3 calcium-rich beverages every day. Lifestyle change and following the supplements is vital for switch patients and is way more important than it is for your sleeve or bypass patients. The operation is performed under general anesthesia and lasts around 2 to 3 hours. The weight loss of the switch patients is about 80 to 90% of the excess weight, and it's lost in the first 2 years post-surgery. As far as recovery for the switch surgery is surgeon specific, but typically people usually stay 2 or 3 nights in the hospital, and typically you go back to work 10 days to 2 weeks after surgery, assuming you won't be doing any heavy lifting. Typically you'll have lifting restrictions, more than 20 to 30 pounds, or doing push-pull motions such as vacuuming are avoided during the first 4 to 6 weeks of surgery. Heavy lifting or pushing heavy loads should be restricted for 3 months after surgery. After surgery, typically week 1 and 2 will be a liquid-only diet. After next 3 weeks, you'll progress to pureed foods and then soft food, and then after about 2 months post-surgery, you'll be able to eat regular food. I hope you learned something from this video and will be more informed about the surgery so you can discuss it with your doctor or surgeon to make a better decision on which weight loss surgery is right for you. Check out my other videos to learn more about the other surgeries and also for advice, tips, and tricks for your weight loss surgery journey. If you found this video helpful, smash that like button, subscribe, share, comment, and as always, thanks for watching.